Although we just wrapped up Cervical Cancer Awareness Month, getting screened when necessary is important year-round. We sat down with a local gynecologist to find out what you need to know. A cervical cancer diagnosis isn't as common as it used to be with the creation of HPV vaccines and eliminating other risk factors like smoking. However, the American Cancer Society estimates around 13,000 new cervical cancer cases will arise in the U.S. this year. So it's still important to get screened when you're supposed to.
They recommend screening starting at 21 up to 29 every 3 years with cytology only. That's a fancy word for they look at the cells to see if there's any changes in the cells that could be precancerous.
Dr. James Barrow specializes in obstetrics and gynecology at Christus Auctioner Lake area. He says starting human papilloma virus testing at age 30 is recommended.
HPV is the actual culprit in cervical cancer. That's what causes the abnormal changes in the cells. And so after 30, we test the cells and we test you for HPV.
And the HPV vaccine helps prevent certain types of HPV from causing abnormal changes to the cervix. Dr. Barrow says one big misconception often portrayed through social media is what a pap smear actually is.
A lot of young girls come in and they think every time that we do a pelvic exam on them, they're getting a pap smear. So I try to explain to the patient that a pap smear is no different than a pelvic exam, except we take a little brush and brush some cells from the cervix to send off to be evaluated.
And in the event your pap smear does come back abnormal,
99.99% it's not cervical cancer. And anything abnormal pap, I try to make sure that the patient understands it is pre-cancerous changes, pre. So these are steps on the way to cancer, and cervical cancer is a very slow growing disease.
As for signs of cervical cancer, Dr. Barrow says they are the same symptoms women can have for everyday problems.
Like abnormal bleeding, bleeding after sex, some things like that. But typically a patient that we see that ends up with cervical cancer, somebody that's not been to the doctor in a long time, they're typically smokers. We rarely see it in young women that are seen by the doctor every 2 to 3 years.
To find more information about the HPV vaccine and when you should get it, visit our website, kplctv.com.